This presentation is brought to you by the Muslim Medics Forum, a group of medical students at Leicester. The topic of this video is the permissibility of gelatin in medicine, a guide for doctors, healthcare professionals and patients. All references will be shown at the end. Bismillah. In the name of God we start this presentation. Gelatin is a substance found in many products all over the medicines and cosmetic industries. But what is it and where does it come from? It is a product of the bones, skin and tendons of animals, most commonly cows and pigs. It is molded into a versatile substance with many uses, one of them being in the capsules of medicines that covers and protects the medical ingredients inside, allowing it to be delivered safely and effectively to the body. Most capsules will be made from the gelatin of not halal cows and pigs, which are unlawful anyway. Gelatin derived from permissible sources is permissible for us to consume. Gelatin derived from impermissible sources is impermissible for us to eat, as it does not undergo the sufficient transformation in its chemical properties. It does not undergo istihala, or transformation to something pure. There is unanimous consensus on this. Therefore, the form of capsules in the Western world are not permissible for us to consume, because they are derived from impermissible sources. However, there are exceptions. If the medicine is necessary after discussion with the doctor, for example, blood pressure control, to reduce the risk of stroke, or you take a capsule every day for depression, and there are no alternatives that are reasonably accessible, then you are allowed to take the capsules. Also, it is important to ask your doctor if the above two conditions apply to you. So what does it mean by alternatives? You can ask your doctor for a different medicine, or a form change like tablets, or solutions, but this isn't always possible. Vegetarian capsules can be bought quite cheap and the medicine swapped into them. For example, you can buy 250 capsules for about £6 and a filling machine to make it easier for about £20. Ask your pharmacist for advice on this. Having said all that, let's talk through some practical advice with some examples. Scenario A. An urgent admission into hospital where you aren't in a position to ask for an alternative. It is okay for you to take capsules. Scenario B. You are prescribed capsules from your doctor for an acute condition, for example a chest infection. Ask for a tablet alternative or see if you can get immediate access to alternative capsules. Ask your pharmacist for this. If there are no alternatives accessible within a reasonable time frame, then it's okay for you to take the capsules. It's really important that you do not delay taking your antibiotics. Scenario C. You take a capsule every day on a repeat prescription. Ask your doctor if there is a tablet alternative of that medicine. If switching isn't possible, you can switch the capsules yourself as mentioned earlier. The capsules work out at about 70p for a month's supply. Before you switch to any alternatives, ask your pharmacist and or doctor if this will be okay with your capsules, as some have special properties that can't be replaced. If you have already started taking the capsules, keep taking them until you can get the alternatives. Scenario D. Taking supplements like vitamin D and multivitamins. Use an alternative form like tablets, or use ones that have vegetarian capsules, or switch the capsules yourself. In all the above scenarios, remember to inform your doctor of what you are doing. Bismillah ar-Rahman ar-Rahim. إنما حرم عليكم الميتة والدم ولحم الخنزير وما أهل به لغير الله فمن اضطر غير باغ ولا عاد فلا إثم عليه إن الله غفور رحيم.